Are you looking at your blood test results and wondering what normal kidney function is, what normal creatinine levels are? My name is Dr. Terranella, and in this video, we're going to break down what the normal functions of the kidneys are and also look at what specifically normal kidney function is and normal creatinine levels are. We'll also look at some of the variables around looking at the creatinine levels and the GFR and some of the stages of chronic kidney disease. Again, my name is Dr. Terranella, and if you're getting a lot out of these videos and want to continue getting videos like this, don't forget to hit the subscribe and like button to keep on getting these videos. I make these videos to help you go beyond basic health, but it's not made for any specific person, so please read this disclaimer before we get into the details. So understanding normal kidney function and creatinine levels involves understanding some basics of how the kidneys operate and their crucial roles in maintaining our body's overall health. In addition, the significance of the creatinine levels in monitoring your kidney health is also a very important aspect of understanding normal kidney function. So first, let's explore some of the kidney's anatomical and physiological aspects that are critical for these functions, and also the biochemical pathways that are involved with creatinine production. And then we'll move on to the creatinine blood test levels for assessing what normal kidney function looks like and what normal kidney function should be. So first, a little bit on the anatomy. So our kidneys are two little bean-shaped organs. They're about the size of our fists, and they sit just beneath the rib cage on our backs. Basically, as the spine comes down the middle and our ribs are splayed out like this, they're sitting right behind that lower rib on both sides. And again, they're about the size of our fists. They're part of a bigger system, our urinary tract system, which also includes the tubes that go down to the bladder and the main tube that comes out when you urinate, which is the urethra. The primary function of the kidneys is to filter the blood. And when they're filtering the blood, they're basically removing the waste and any excess substances that are found in the blood. And by doing that, they're basically maintaining an overall internal homeostasis and stability inside the body. Each of these kidneys have about 1 million nephrons in it, and a nephron is a functional unit of filtration. And basically what makes up a nephron is a tiny little capillary blood vessel system in a tube that allows for the filtrate part of the blood to drain into that tube. So the glomerulus filters the blood, leading to some waste products, which can then pass into the tube. Once it's in the tube, some of those waste products or some of those products actually get reabsorbed, like some nutrients, minerals, electrolytes, and water, and those are reabsorbed based on what the body's needs are at any given moment. And the waste products or excess water is excreted through our urinary tract. So when it comes to normal kidney function, it basically means that our kidneys are filtering the blood and allowing for this normal homeostasis to take place without any problems arising. So some of the key roles of the kidney in terms of maintaining this homeostasis, or the key functions of the kidneys, include excretion of waste, as we talked about. Of course, the kidneys remove a lot of different things, including urea and creatinine, the thing that we're going to be discussing for monitoring normal kidney function. But these are different metabolites of the body. And of course, the water level would be number 2. In balancing the overall hydration and water in the body, the kidneys play a critical role in fluid levels, and part of balancing that overall water balance is also number 3, which is balancing the electrolytes in the body. Things like sodium, potassium, phosphorus, even other smaller minerals are meticulously balanced by the kidneys. And when those electrolytes and fluid levels aren't balanced the way they should, it can lead to problems with blood pressure. And the kidneys play a direct role in regulating blood pressure through its production of renin and this broader system known as the renin-angiotensin system. So the kidneys are involved with the regulation of blood pressure as well. And it's also important for the production of red blood cells. Red blood cells are traditionally thought to be produced in the bone marrow, and they definitely are, but the kidney produces something called erythropoietin, which stimulates the bone marrow to produce those red blood cells. And there's also the overall pH balance. A lot of people will check their pH and see whether or not they're alkaline or acid through looking at those pH urine strips. Well, the kidneys are actually doing some work behind that. So if you do end up with too much acidity in your blood, it's going to balance some of that out by how much acid and base that it's allowing to exit or stay in the body. So those are some of the key functions of your kidneys and maintaining this homeostasis. But where does the creatinine blood test and normal creatinine levels come in terms of what your kidneys do? Well, creatinine is a waste product generated from muscle metabolism, and specifically it's creatine phosphate that the muscles are producing. And this molecule serves as a quick energy source for the muscles. So the production of creatinine depends on the overall muscle mass in the body, which is relatively constant to the individual. So with that muscle mass being constant, the creatinine production is also steady and constant, and its levels in the blood reflect the ability of the kidneys to filter that blood. So a normal creatinine level is going to vary by age a little bit, and sex as well, but also body size because it's reflecting that muscle mass. So for men, the normal creatinine range is a little bit higher. For women, because there's more muscle mass, and it's about 0.9 to 1.3 milligrams per deciliter. For women, the normal creatinine range is 0.6 to 1.1 milligrams per deciliter. So when that creatinine level starts to increase, it indicates some sort of impairment or slowdown in the filtration process in your kidneys. But if you're someone with larger muscle mass, or you just have increased muscle turnover because you're exercising a ton or did some kind of crazy exercise routine before your blood test, you may have a higher creatinine level despite having normal kidney function. And I did do a separate video on this topic if you want to look at this. And we also discuss some alternative kidney function testing as well beyond the creatinine, so you don't have to rely on the muscle mass variable. On the flip side, low levels of creatinine can also be seen in conditions with low muscle mass, decreased muscle mass, or if you're just small framed in general. Sometimes low creatine phosphate production can be from that. There's also specific genetic alterations in the enzymes that produce creatinine, and that's also connected to this broader process of methylation, which you may have heard of as well. It's related to MTHFR and things like that. But generally, in terms of normal kidney function, we're worried about elevated levels, not low levels. But if you do have low levels of creatinine on an ongoing basis, it may be something to look at, especially if you're like normal size or even larger size, and you have that could be something to look at more specifically. So again, what does the creatinine level or even the GFR tell us about normal kidney function? So from the creatinine blood test, we can basically calculate the creatinine clearance rate, or the GFR. And GFR stands for glomerular filtration rate. And this is measured to really understand what this filtration rate is. And again, because that muscle mass is constant, the creatinine is constant, and we should be able to get this rate of filtration. The only variable being if you do work out a lot, then the amount of creatinine turnover is going to be much higher, and so it skews that result. By work out a lot, I mean do a really vigorous exercise. If your exercise level stays pretty constant, it's not going to have a lot of breakdown of that muscle, so therefore it's not going to alter the creatinine value all that much. So anyways, GFR and creatinine are critical indicators of your kidney health, with normal ranges for your GFR being somewhere around 90 to 120 mLs per minute, and it's normal for that GFR to go down and kidney function to go down with age. When values get below 60 mLs per minute for 3 months or longer, it can indicate that you may be having something going on with your kidneys, such as a chronic kidney disease. Typically, though, it's not just the GFR that's an indicator of chronic kidney disease. In addition to a lower GFR, for firm diagnosis of chronic kidney disease, there typically is going to be evidence of some kind of kidney damage or problem in the kidneys. So for instance, you may have protein in your urine or proteinuria, and this suggests that your kidneys are no longer filtering the albumin that's in your blood. And instead of holding onto that protein, it's going to spill it out. And that's a problem because these proteins are really important. And if you're just dumping them out all the time, then your body can have other problems too, because proteins are needed to balance out the overall fluid in our bodies as well. So a lot of times when there's protein in the urine, it indicates some kind of damage to the glomeruli, because that protein is leaking through the filtering process, and it's supposed to stay in the blood. In addition to protein in the urine, sometimes you can have blood in your urine, which may be microscopic, or it could actually be visible blood and showing like change in your color. And when that's happening, it also suggests something going on in the kidneys. Could happen for other reasons outside of kidney damage, but kidney damage would be one of the common ones. And then, of course, there's structural abnormalities too, changes in the kidney structure that might be shown on an ultrasound or CT scan. Can also indicate chronic kidney disease. You can also have electrolyte imbalances and other metabolic changes in your blood that are signifying some sort of chronic kidney disease. So it's actually the combination of something showing up as a problem with your kidney function, whether it's coming out in your urine or an image or blood, and then also the reduced kidney function as well. Sometimes there's histological changes that are shown through a biopsy as well that would require a lot more higher intervention. All that just to say that just because you have a low GFR or elevated creatinine doesn't necessarily mean that you have chronic kidney disease. Usually you have to have some problem with the kidneys themselves, as evidenced by the things that we just mentioned. And sometimes it's just a transient dip in your kidney function due to exercise or dehydration or something like that. But still, the whole point is to have optimal kidney function or normal kidney function, and monitoring your creatinine levels and GFR is essential to be sure your kidneys are maintaining their health and not declining too much as you age. And this is important in particular as we get older, but also for people with problems like diabetes, high blood pressure, and people with family history of chronic kidney disease. You want to be particularly mindful of monitoring the kidney function. So normal kidney function occurs when the kidneys are filtering properly and the creatinine levels stay somewhere between 0.6 and 1.3 milligrams per deciliter, roughly, depending on if you're male or female. Those are going to be slightly different. And there's no protein, blood, or other abnormalities noted through imaging or other lab test metrics. Now, some of you may be confused by the stages of kidney disease and the normal kidney function because there's some overlap where stage 1 chronic kidney disease have a corresponding GFR of greater than or equal to 90 milligrams per minute. And at stage 2 chronic kidney disease, you have a GFR of 60 to 80 ml per minute. So does that mean if you have a GFR of 70, you're sitting at stage 2? Well, no, not necessarily. You would also need to have some notable problem with the kidney filtering capacity as well. Normal glomerular filtration rate or kidney function is thought to be above 60. Optimal is going to be a bit above that, but really it is going to vary based on your weight and muscle mass. So I can't say for sure that everyone's GFR using the creatinine clearance method should be above 60. It's going to be different based on your size and overall muscle mass. You may want to do a separate test or a different test that looks at a non-creatinine method of measuring your kidney function, and that's called cystatin C. But generally speaking, when my patients' GFR start to get into the 60s, I start to pay closer attention. And of course, the normal creatinine levels is a key benchmark to understanding or assessing your kidney function or what normal kidney function is. But what if your levels are starting to go down and they are in the 60s or no longer look normal? Are there warning signs of kidney issues that might tell you more about this? That's what we're going to look at in the next video. But if you do have questions about anything in this video, drop them in the comment section. I'll do my best to answer your question. If you want a more customized, detailed answer, consider joining the membership program. We'll have more time and attention to dedicate to your answer. Thanks again for watching. We'll see you next time.